Disturbing news about the serious stress of being a teenager. New data from the Pew Research Center shows life is getting more difficult for teens, especially when it comes to mental health. Dr. Sarah Getch and also Dr. Robynne Lute from the Kansas City University of Medicine and Biosciences are here to talk about the effects of anxiety and depression on teenagers. Ladies, thank you so much for coming. This is disturbing news and research. Is this what you're seeing in your practices as you're dealing with teenagers?
Well, absolutely. And keep in mind, we're coming from Kansas City University where we're teaching. So mostly we're seeing our students coming back and reporting difficulties with the patients that they're working with. As parents and just community members, certainly seeing these rises in anxiety and depression are very concerning.
What is causing this? What's triggering this?
So we don't know the exact cause of what's happening, but we have some hypotheses, or at least the researchers who've conducted this study have some hypotheses. And what they've ruled out so far is, the economy has been getting better, so it's not the economy that's contributing. We also know that socioeconomic status is not acting as the same buffer as it used to, so being well off or affluent is not really a protective factor any longer. So we're sort of ruling those things out. And what we're seeing is that this change is really a generational or cohort issue, meaning we need to look at the context in which these children are in to understand these increases. So there are some hypotheses. It might be increased screen time. So the devices that we're using or social media has played a big role in this potentially. Access to information. It might be better diagnosis, right? So we might just be doing a better job identifying. So there are lots of ideas. Oh, and then also sleep. We know that children are not sleeping as well as they used to, which might also be tied to the usage of their devices.
So the next question, of course, is what can we do? What can teens do? And then as parents, what can we notice, and then how can we respond?
Those are great questions, very important questions. So for one thing I would want to say is that the earlier we start, the earlier that we're watching for signs and symptoms. So our children and our teens should be able to love well and be attached to family members. They should be able to get upset and be able to express that, self-soothe, and come back to their normal state, right? Okay. So in terms of what parents can do, really starting early and having as much prevention as possible, watching to make sure that your kids are self-soothing, they are self-regulating, and knowing when things seem to be changing in intensity, they're happening more often, emotions are expressed a little bit more dramatically. Those can be some signs or some where you want to take a little bit of a closer look at what is going on.
And if we miss these signs, that's where, we miss the boat. And that's, we're talking about suicide. I mean, these are some serious outcomes if we aren't watching.
All right. And I think that these days what we're seeing is not only a change in our children, but a change in parenting. And so we used to hear this term called helicopter parent. Maybe you've heard that term. But now what we worry about is the bulldozer parent, the parent who removes all obstacles from their children. And when we remove obstacles, we don't learn really important skills. We don't learn how to be resilient. We don't learn grit. We don't learn that we are built to do hard things, and we can recover from that and learn from that. And so as a parent, we have to reflect on ourselves and say, well, what can we do differently to prepare my child well?
That's really excellent. This has been an amazing conversation, very important for parents and teens. And so, ladies, thank you so much for coming and for sharing. And thank you at the Kansas City University of Medicine and Biosciences for preparing, the doctors and psychologists. There's a greater need for them now. And so we thank you for that.
Yeah,
Thanks for coming.
Thank you.
Now, here's Kansas City's most accurate forecast from